the Chief Medical Officer at Esri, which is a developer of the world's most powerful mapping and analytics platform. And Dr. Geraghty heads Esri's worldwide health and human services practice. Previously, she was Deputy Director of the Center for Health Statistics and Informatics at the California Department of Public Health, in addition to serving as Associate Professor of Clinical Internal Medicine at the University of California. She received her medical degree, master's degree in health informatics, and master's degree in public health from UC Davis. And she's board certified in public health and is also a geographic information system professional. We are so excited to have her here with us today. And I can't wait to hear more about what Esri is doing to help organizations fight COVID. So welcome.
Thank you, Cindy. Well, I'll start sharing then. And let me share my screen and make sure I do this properly. And I'm hoping that you're seeing my screen. And if you're not, then somebody shout out for me. But I have to say, it's truly a great pleasure to spend this time with you today, talking about putting geographic information systems to work for COVID-19 response and recovery. Now, the first question that you may be asking yourselves is, what is Geographic Information Systems, or GIS? Well, this is a technology that is based on geography, and geography is truly the science of our world. I mean, think about it. Geography provides all of the rich content of our world. There's biological content, ecological content, sociological content, any of the ologies that you like. And that content is then put into context by using a common reference system, geographic location. The geographic lens helps us more easily see and digest complexity and relationships and patterns. And I think this is part of why people really love maps. And the science of it really brings it all together in this most remarkable way that really helps us to understand, and it helps us to intelligently respond. Now you might be thinking, oh, okay, GIS is a map. Well, true, but also GIS is much more than a map. It's a system that provides a framework and a process for tackling almost every kind of challenge that people need to address. I think of it as kind of like a workflow. We know it all begins with data and measurement, which we then want to be able to visualize and analyze to get that deeper understanding. That helps us get to those important stages of designing our interventions, making decisions about priority, how, when, and where to act. And then we can take that action and monitor and evaluate our outcomes. So a modern GIS system has tools to do all of those different things. And without trying to teach you everything about a GIS, I do think it's important to know that a GIS system is capable of reading in all kinds of data, whether it's tabular in a spreadsheet, imagery, three-dimensional, real-time, or even unstructured data. And that ability to integrate all of those different kinds of data by their common geographies is one of the things that makes a geographic approach so darned powerful. In other words, it really helps us to link up data sets that might otherwise be considered unrelated. Using this kind of system, I've actually seen a lot of innovation over the last 9 months, and I'm going to be sharing some of that amazing work with you today. But you know, some people don't believe that you can or even should innovate during a crisis. Oftentimes, people are so busy responding to the crisis that they feel that they just don't have the time to improve their systems. And initially, I have to say that may make a lot of sense, right? But actually, according to the Harvard Business Review, a crisis creates a number of conditions that really work together to support rapid and impactful change. Here's why. One of the first things that happens is that an organization will unite around a shared purpose, which enables a sense of courage to take action that might have been unthinkable during more calm times. A crisis also tends to magnify and clarify where vulnerabilities or problem areas exist. And this forces us to confront our systems that may not be working well. And we start to see things a bit differently, and that gives us ideas for improvement. Now, the other thing that happens is that there's a lot of incentive to get things done quickly, and that can really help us to overcome bureaucratic red tape. And as you well know, a crisis can create a great deal of energy just to move forward. And when that energy is focused on a common goal, a lot of innovation can get done. And so I'd like to show you a short video that we created to highlight some of the early innovation that we witnessed from GIS users. So let me run that video for you. I really love that video. It makes me feel like a part of something bigger. But perhaps now you're beginning to see that there's so much to be gained from using GIS for health. Now, for many years, health organizations have amassed impressive stores of data. With GIS, however, we can go beyond collecting the dots. We can use place and location analytics to connect the dots to create new insights, information, and informed action. So I'll show you how folks are collecting and connecting the dots across 3 different patterns of use that we're seeing deployed in very impactful ways to respond to COVID-19. Then I'm going to show you how we can apply those very same patterns to other health challenges that we're facing in our communities and in our countries. If we're going to gain anything from these challenging times, it'll be the lessons we've learned and applied to make us more resilient and more responsive going forward. So let's begin with mapping and monitoring disease. I'm assuming that this is a familiar sight for everyone, the world famous and in fact iconic Johns Hopkins University dashboard. This dashboard, built with GIS technology, is the most viral map-based application in history, and it really woke up the world to the evolving outbreak. They've collected the dots and they continue to do so to this day. One thing that's so important about this dashboard is that from the beginning, the JHU team made sharing those dots their first priority. This enabled all kinds of organizations to connect the dots through visualizations, analyses, and planning scenarios that enhance decision-making for their COVID-19 response. And people did connect the dots to map and monitor disease around the world, like the Africa CDC, showing the COVID-19 status for an entire continent with the option to focus in on the various regions across Africa. In South America, we can look at the country scale and see that Colombia is paying close attention to the origin and importation of cases. In Australia, for the state of New South Wales, the University of Sydney took their analysis all the way down to the postal code level. And they also added this handy filter so that we can home in on higher risk populations. In Asia, Hong Kong is sharing data on cases and hospitalizations like everyone else, and they're also mapping the actual buildings where there have been confirmed cases. In North America, the state of Maryland shares their data at the zip code level, along with detailed information on testing volume and the % of positive tests. As a leader in transparency, the state is also sharing this dashboard indicating ventilator trends and current availability, as well as this remarkable dashboard that gives us statistical information for each and every nursing home. Dashboards are being used for more than mapping and monitoring COVID cases. For example, the University of the Aegean is interested in the Southern European countries, showing places where young people are at higher risk of unemployment due to the pandemic. So I think you can see across every continent and at every scale, even all the way to the region of Timbuktu in Mali, people have been mapping and monitoring with dashboards to understand the novel coronavirus. Efforts to connect the dots continued with mapping the spatial and temporal spread of disease to understand the pace and direction of disease movement. I've always liked this visualization that comes from the University of Virginia's Biocomplexity Institute. They have a time slider, you can see that across the top, so that you can review the day-to-day cases or several other different indicators throughout the entire duration of the outbreak. Another effort to connect the dots was to classify the trends using the most recent 2 weeks of data in each county based on the number of cases per 100,000 population, and then fitting that to the pandemic phases as outlined by the World Health Organization. Darker pink is worsening phases of the pandemic, and greens are in controlled or end stage. This map, by the way, is current as of Tuesday. But we realized that decision makers needed to see all of the history of cases over time in addition to the current 2-week trends. So my colleague John Nelson built COVID Pulse, which is this app that makes every place trend easily comparable to every other place trend. Now the little lines across the map are called Sparklines, and they're a graphic technique that in this case allows side-by-side comparisons without using any access. There are no words, it's just fully the data. In this view, you are comparing data for more than 7.8 million cases in the US for over 3,000 counties occurring over more than 260 days. It's really remarkable. And these pop-ups at the bottom will add detailed information whenever somebody wants to dig a little bit deeper. There are really countless examples of how health organizations have been mapping and monitoring disease to give them a better handle on what populations are experiencing. Infectious disease surveillance is perhaps the most common area of work, from mapping malaria transmission in Kenya to the presence of African swine flu in South Korea. But many are also mapping chronic diseases like cancer, diabetes, obesity, smoking, drinking, and much more. Now, understanding the impact of context on health is another prevalent area, looking at things like lead poisoning and low birth weight babies. And lately, we've started to see more and more efforts that are focused on operational kinds of workflows, like monitoring wastewater actually for the presence of opioid medications, or monitoring patient flow in a hospital as they're doing in Argentina. Mapping and monitoring disease is a great place to start with GIS in health. Now, next, we're going to dig into analysis, which is one of my favorite areas. I think of it as being a disease detective, right? Where's the problem? Where is it changing? What are the underlying causes? And how can we improve outcomes or forecast what may be coming our way next? Well, in COVID-19, governments wanted to start understanding gaps in services or in health outcomes by figuring out who is more or less likely to be affected. Now, those that are more likely to be affected are considered vulnerable populations. So with COVID-19, people could be vulnerable for any number of reasons, and we can visualize and analyze those. So it could be older age or medical comorbidities that make some people obviously more susceptible to severe disease. People might be considered vulnerable because they're essential workers and they're more likely to be exposed to the virus. Or perhaps the vulnerability is because they live in congregate housing like nursing homes, university dormitories, or prisons. We can overlay all those various vulnerabilities so we can highlight and pinpoint those highest risk places for COVID-19. And we also used analysis to perform capacity forecasting. This is where we used models that could take hospital bed utilization data and mash that up with social distancing behaviors and understand what might happen over time with local hospital bed capacity. Every hospital and every government really did want to be able to predict whether their curve would stay flat, maintaining that health system's ability to care for each and every person who walks through their doors, or if some hospitals may become overwhelmed and exceed their capacity to provide care. Harris County, Texas was analyzing accessibility of testing sites for COVID-19, and they coined a new term. Similar to the idea of food deserts, they detected testing deserts in their community where people just didn't have good access to get tested for the virus. And of course, you can go really deep into analyzing relationships and connecting the dots using GIS. I love this example of looking at social distancing and weather data in California. So the bars are showing you social distancing grades where red gives you an F and blue gives you an A. And we can see the date that California got their stay-at-home order in March. Before that, everything was red, right? Nobody had to social distance. But once that went into place, it seems the coastal counties did pretty well with social distancing, while our inland counties did a little less well. Well, very soon, toward the end of April, something happened. We started to see a bunch of crowds headed to the beaches in California. So you start to wonder, well, what is it that made people abandon all social distancing and make their ways to the beach? Well, we thought weather had something to do with it, so you pull in data from NOAA. And we can build this up in 3 dimensions. It's called a voxel layer. So think of volume in pixels, and you get the idea of looking at temperature over time. So the darker brown, goldish colors are hotter temperatures, whereas the blues and greens are cooler. So Esri headquarters is actually located in San Bernardino County, and we're going to focus in on that area next. So we're in inland county, and when the weather got a little bit warmer, you can see a lot of people from this county stopped social distancing. So maybe some Esri employees took the day off and went to the beach. I don't know. I hope they all stayed safe. But you get the idea. And then you can start to take these kinds of visual correlations and do statistical analysis to see what the relationship actually is, which I think really helps us as we develop guidelines for policies and understanding human behavior. And I could probably go on and on for days about this pattern of analysis and how it applies to health concerns outside of COVID-19. Around the world, there is a lot of effort to use mapping to really better understand things like racial and ethnic disparities or notable vulnerabilities, like in Finland. In Lebanon, they're using mobile survey tools to better understand the lived experience in disadvantaged neighborhoods. And across Europe, there are efforts to look at civil unrest and identify and manage pockets of unrest, especially in areas with high COVID case counts. GIS can really start to make the complex more simple, like the risk factor map for homelessness on screen. By understanding that certain areas experience more homelessness because of unemployment, while others are generating homelessness because of domestic violence, we can start to put the right interventions in the right place to really help solve the problem. I also really like the analysis of Aedes mosquito habitats around the world so we can better plan mosquito control efforts that prevent Zika virus, dengue fever, and chikungunya, to name a few. Now, the third repeatable pattern we've seen a lot of for COVID-19 is strategic planning. Now, it turns out the two staples of geographic problem solving are site selection and calculating the geographic accessibility for various places. These methods have been used for things like standing up new testing sites, distributing food, and extending healthcare services in those places where hospital capacity actually does become overwhelmed. This concept uses location allocation as a method. So let's just say that we want to stand up new testing centers in those places I showed you in Texas that were testing deserts. So for COVID, we begin by determining the population demand, or you might say the population need for that particular service. We can do this by overlaying all of the risk factors contributing to each of the 5 COVID risk types: transmission risk, socioeconomic risk, the susceptibility to the disease risk, exposure risk, and resource insufficiency risk. In the end, what we're able to create is a risk ranking considering all of this over very small geographies, maybe like neighborhoods. And to calculate then the best testing center locations, you use those risk rankings for population demand or need, along with road network data, so you can calculate drive times and drive distances. And then you input any constraints you might have, like you have a budget for only 10 new sites, or you have limited staff that can support the new sites. So the model takes all of those factors into consideration and selects the top 10 most optimal sites from the entire population of options that are available. Well, then you have to consider, how do I get people to be able to find the resources that I've stood up and that they need? Well, you use resource locators like this one from Valencia, Spain, that can be used on any device, a mobile, PC, tablet. And when the user places a pin on the map, maybe their current location, they can get information about the nearest hospital, pharmacy, social services, or testing sites in the area. There's really no question that COVID-19 inspired great innovation in connecting the dots to support response to this pandemic. When we think about tracking our capacity to respond to the pandemic, it goes well beyond what I showed you with the forecasting hospital beds and ventilators. It also includes thinking about the availability of personal protective equipment. Simple survey tools connected to dashboards really help to connect and collect and manage critical supply inventories for each hospital within a health system, and it also allowed reporting to regional or national governments so that they would have this information. Now, I'm going to take a few minutes to dive a little deeper into 2 important strategic planning areas going on right now: contact tracing and planning for vaccine distribution. Now, as you may know, contact tracing is a process that health departments perform to break transmission chains before an infected person has any chance to spread that infection to other people. And I actually became a certified contact tracer to make sure that I fully understood this process. So we're using GIS to help health departments collect and manage their contact tracing data, to do rigorous analytics, and to evaluate their process. So this is a sample contact tracing form. And in the exposure information section, which I blew up for you on the right, it's asking location-oriented questions like, have you traveled domestically in the last 14 days? Well, if someone responds yes, then the contact tracer is asked to fill in which state that person visited. Well, states are pretty large areas, and that level of location just is not very useful. We developed apps to make gathering finer scale location information, as well as conducting all of the interview questions, really quick and easy. Once the data are collected, health professionals need to be able to perform analysis. And this is especially important for COVID-19 because a lot of viral spread happens by community transmission. In fact, we coined a new term for this kind of analysis that we call community contact tracing. What it means is that people who get sick can't always identify how or by whom they've become infected. So to understand this, we start with the locations that we collected in our contact tracing interviews. And then we can take that information, even if it came to us from a spreadsheet, and put it on a map, marking the very beginning step in a spatial analysis. Well, the first analytic function that we might perform is density analysis, which is visualized here as a heat map, possibly providing early clues about higher risk locations. In fact, the spot that's lighting up in this example is a nursing home. Then we can move on to link analysis, which gives us a better understanding of the person-to-person connections that are the traditional focus of contact tracing and very important. And we can use tools from graph theory that help us to determine the strength of person-to-person to place connections that are so important in community spread of disease. We can use dashboards again as a way to evaluate and improve our contact tracing process. By monitoring how we're doing, we can help with identifying and coaching those contact tracers that maybe aren't keeping up, or we can hire new contact tracers if we've discovered that the workload is the problem. Or maybe we're even able to identify other bottlenecks in the system, which is so important because it could impact the efficiency and thus the effectiveness of the whole process. Now, the other area that I wanted to touch on just a little bit more today is planning for equitable and efficient distribution of vaccines across each country and around the world. There are some very complex and challenging issues in this effort that it turns out a GIS can nicely support, like identifying facilities that can store and administer the vaccines, determining where concentrations of high priority populations are, exposing gaps in access to vaccine, and formulating plans so that we can reach everyone. GIS can help manage and monitor the vaccine administration and inventory system, as well as share progress on vaccination delivery across our communities. One of the key tasks for health departments will be to figure out how to prioritize vaccine delivery in a way that ends the pandemic as quickly as possible. I know we would all hope for that. And this means considering vaccinating healthcare workers on the front lines first, and then prioritizing other populations in consideration of those most likely to suffer severe disease, like the older adults, those most likely to be exposed, such as essential workers, and those most likely to transmit disease, like the people living in congregate housing. It all works together, and GIS can make this task a bit easier. Once you know where those critical populations are, and perhaps you've done some location allocation to find the best vaccine venues to administer the vaccine, well, then you can calculate their reach. How many of the critical population can be served by each location? And it's inevitable that there will be gaps. Some populations will be out of reach of the vaccine venues. And we can make plans to site new vaccine venues and see how well we can serve the underserved population. We can also partner with locations that already exist, like retail pharmacies who may be able to support broader distribution for difficult to reach populations. And as this enormous global challenge continues to evolve, it will be really important for decision makers to constantly evaluate the process and the productivity of each vaccination venue. And I think it's going to be equally important to share vaccine progress with the public. Now, strategic planning in health or any other sector is really about applying whatever limited resources we have in the most effective ways possible. Health facilities are being cited in Kenya, Oklahoma, and Japan. And then many are focused on how do we get people to their health facility and their healthcare appointments. So we see GIS-based planning efforts to provide public transportation and ride-sharing options. And nowadays, health organizations want to consider expanding services digitally through telehealth or e-health options. Folks are using GIS to determine if there is sufficient need for those services by assessing travel burden across their populations, checking to see if the broadband coverage is adequate, and refining the service offerings by understanding the underlying population health needs. I have to say, we're probably never going to forget our stories of isolation and quarantine, of local social distancing efforts, that hunt for toilet paper, and the creative ways that we wear face masks in public. And of course, my hope is that we never forget the valuable lessons that we've learned along the way. Like I said in the beginning, it's not uncommon to see great innovation alongside a crisis. It's really never been enough to simply collect the dots. GIS supports health and other industry areas by helping us to connect the dots in ways that inform, inspire, and initiate change that I hope makes us all healthier. And so I want to thank you very much for your attention today, and I'd be happy to answer any questions that you may have.
Thank you so much. This is fascinating. I love the video, especially. It's really powerful. And we have some questions about a number of things. So we'll start off with, what do you feel about using location in phones to identify people affected by COVID? Like those, finding out that there was someone with a positive test around you. How could that data be shared anonymously? And what do you feel about that?
Yeah, so I personally am not a big fan of that. I mean, our technology could do that. That's not really the problem. I don't think it's going to be socially acceptable in this country, although I know some states are trying to do it. It also takes a large portion of the population to make it truly effective. And then the other thing is that this uses GPS technology, and it's not accurate in certain situations. For example, you could be in close contact with somebody or be considered in close contact, but you're actually, two people waiting in front of a train and you're in cars next to each other, but you're not really in close contact, or two people on different sides of an office wall or a building inside and out. So it comes with enough problems that I don't think it's the most effective way to go, but I know that it has actually been successful in some other countries. So I wouldn't totally discount it. I just am not sure that we're ready for it here.
That makes sense. And we have another one. No company across the globe could forecast and anticipate the impact of COVID using any of the AI we're discussing now. But would it not be apt to use these technologies as early warning systems with accurate and precise predictions rather than post-mortem?
Yeah, absolutely. I mean, I think the way I look at how we prepare ourselves for whatever comes next is it's sort of twofold. There is the disease surveillance component, which is a very geographic kind of activity, right? You need to have the input of data and see where things are happening and how they're moving to be able to properly surveil disease. And I think the other component is one way that you're ready is you start to have data stores, we call it foundational data, ready to go in any emergency. So you already have collected the data for all of the hospital systems and their bed capacity. You have the data on all of your population demographics for your locality. You have all of your community partners aligned, and you can pull those data sets and work with them, for us geographically in a snap. It's the current information products will be unique, but the underlying data is something that everybody should be holding on to and updating on a regular basis.
Yeah, that makes a lot of sense. Will you share a little bit more? This is a question I put in about, so, the Hopkins map, we all know it. It'll probably be in the history books, right? What is the process of where are they pulling the data from? And then what Esri platform or tool are they using that makes it consumable to people like me, who I'm not a computer scientist and I'm not a statistician?
Yeah, honestly, the very first iteration of the dashboard, they made in about 3 hours using ArcGIS dashboards. It's an application and it's very configurable. It's pretty easy to use. And they pulled data from a number of sources, so just vast sources. They now have a team of like 24 people that are pulling data from all of the different localities in the US, and from, there's a data resource that they used in China in the very beginning that actually is international. So it's a vast number of data resources, but it's updated multiple times a day depending on what the data resource is. And what they did was they initially were collecting their data on Google Sheets, and then they turned it into an ArcGIS feature service so that anybody could pull it and use it. And that's part of what made it so powerful. But one of the things, you mentioned the history books, and people often love the statistics. That data service at its peak, the dashboard, was being requested at a rate of 4.2 billion times a day. So think about that relative to the US population. Everybody was using it.
Well, we're all sitting there thinking like, oh, that was 17 of those was me.
Me too.
That's amazing. Well, let's see, we've got some other interesting ones. So how have the contract tracing models changed as we better understand how the virus works? So, if you're, from what we read and understand now, if you're in proximity with someone and you're both masked and it's only for 30 seconds, like in line at Target, probably not something to worry about. But if you're in a confined space for an hour and a half, like a movie theater, that is something to worry about. Do the models get changed as we better understand the virus?
So yes, I think that as we understand the virus, a couple of things changed. You pointed out some good parameters that are changeable, as well as things like how long does somebody need to isolate if they have contracted the virus? How long does somebody need to quarantine if they were a close contact? And then I think this idea of location is another change. I think that's still evolving, because the analytics, I don't think, have been set up, other than some of the work that we're trying to do, and perhaps some other companies, to figure out how do we detect and manage these concepts of community spread and places rather than people that are causing a problem, right? And we've read about that in the news, right? Some of those places are really obvious: meatpacking plants, universities. It's not necessarily rocket science, but we go back to that question of surveillance. Can we get it sooner? Can we use contact tracing to stop some of that from spreading as widely as it has?
And then I know we're at time. I'm going to ask one more.
Okay.
Sort of for clarifying, we are on a break now, so we're not bumping up into another session. What is the role of AI and its utilization in GIS data gathering?
Yeah, so AI is an important area, and one of the areas that I think is so fascinating and that I know about. So I don't know everything, but in data gathering, one of the places that I've seen be really impactful is this idea of imagery classification, and doing that in real time. So say, for example, in the health world, maybe we're wanting to prevent pedestrian accidents, and we find that there is a street corner where that's happening all the time. So we can use, cameras that are already out there, right, monitoring the traffic through an intersection, and classify cars by their speed and their type, and start watching that to start to get more information about what is actually the issue. Are people not stopping at that particular place, or is it different kinds of vehicles that are doing different things? But that's definitely an artificial intelligence usage. From there all the way to finding parking spots in a large lot, you know, to everything. We actually are using it in GIS, not COVID related, but for predicting restaurant inspections and prioritizing which restaurants you should inspect first based on their higher likelihood to fail an inspection. So preventing foodborne illness.
That is one we wouldn't have thought of on our own. That's a great example. Well, thank you so much. This was fascinating, and we're so grateful to have had your time and incredible knowledge. For those of you on the line, thank you for joining. We've got a quick break now between 2:30 and 3 Central. Go to the Expo Hall. There are, we've got some great companies, including Esri, and lots of cool prizes actually. So do some clicking, do some talking, and we will see you back at 3 o'clock. And Este, thank you so much.
Thanks, Cindy. Bye, everybody.
Bye.